A very good morning to everyone present here. I'll be presenting my paper on knowledge and attitude about eye donation among medical and nursing students in a tertiary care center in Western India. There are no conflict of interest. Corneal blindness is an important public health problem in India, but the widespread use of keratoplasty remains hindered by the relative scarcity of donor corneas. This has been attributed to the unwillingness of potential donors to place their eyes, as well as to the failure of healthcare workers to educate them about the process. So the aim of my study was to assess the knowledge and attitude about eye donation among medical and nursing students, and they included residents, interns, MBBS students, as well as nursing students. It was a cross-sectional study with convenience sampling, and the sample size was 500. As per the inclusion and exclusion criteria, 500 medical and nursing students in a tertiary healthcare center in Pune were administered a questionnaire about eye donation. Responses were recorded in Google Forms and converted to Excel format for analysis. The inclusion criteria included residents working in all the departments, preclinical, paraclinical, as well as clinical, students studying in first year to final year of MBBS, interns, as well as nursing students. The main exclusion criteria was the residents of the ophthalmology department in order to eliminate any bias. 59% of the participants were females and 41% were males. Majority were MBBS students, which was followed by nursing students, interns, and PG residents. So the questionnaire was divided into two halves, the knowledge domain and the attitude domain. The knowledge domain had 8 questions, and each of the questions was scored as 1 point. Only 35.2% of the participants were aware that either the cornea or the entire eyeball can be removed for donation. 47.6% thought that it is possible to specify who will receive the donated eye, and just 37.4% knew which media can be used for preserving the eyeball. So each of these questions was given 1 mark, and the total score was calculated out of 8. The knowledge was graded as excellent if the score is more than 6, as good if it is between 4 to 6, and as poor if it is less than 4. Only 9% of the population of the participants had excellent knowledge about eye donation, and 20% had poor knowledge about eye donation. Only 49% were willing to donate their own eyes. Please note, this is not the lay population. These are the medical students who will be the future healthcare workers of the country. Only 33% were willing to donate their relative eyes, and only 35% were willing to donate eyes for research or training purposes. So we inquired about the reasons for the unwillingness or undecidedness for donating their eyes. Majority answered that they need more information about eye donation and the transplantation process, which was followed by the reason that their family won't be supportive of eye donation. Some other reasons also included that I have high myopia. I haven't discussed with the family yet, and even that it will hamper my vision in the next life. So we discussed about the motivating factors which will have a positive impact on the participants about eye donation. So majority were of the opinion that if they get more information about eye donation and the transplantation process, they will be more positive towards eye donation, which was followed that if their family member or a friends need a corneal transplant, then they will be more positive. So from the study, we found that only 9% of the students had excellent knowledge, while 20% had poor knowledge about eye donation. Only 49% were willing to donate their eyes. 42.6% needed more information regarding the subject, and 44.8% participants would consider donation if they had more information on the subject. So there is a need to impart knowledge and modify the attitude about corneal transplantation among medical and nursing students, since they will be playing a major role in educating and motivating potential donors regarding eye donation in the future. Mass education and awareness programs are also needed to encourage the attitude of family as a unit, since many of the participants were hesitant for donation because of lack of family support. These are my references. I would like to conclude by saying, आँखों की खूबसूरती पर बेपनाह लिखने वालों, आँखों की खूबसूरती पर बेपनाह लिखने वालों, एक निगाह उन पर भी डालो जो देख नहीं सकते. I request everyone to please pledge their eyes for donation. Thank you.
Thank you.
Thank you.